This presentation is for Dr. Huerta's HOM 5308 class. It will provide an overview and show the importance of quality in healthcare by focusing on 2 case studies. It is presented by Marie Smyth, Megan Moonjian, and Jason Rogers. Healthcare is facing many different kinds of problems and issues today. These include rising costs, increased demand, and keeping up with the ever-changing world. One might ask how, with all other demands, can healthcare organizations afford to focus on quality? How can quality help? Quality can be defined as character with respect to fineness or grade of excellence. Excellence should be something that healthcare organizations strive for. Poor quality can lead to mistakes, and mistakes in healthcare can be costly in human life, dignity, and financially. Poor quality doesn't always lead to death or injury. It can also lead to reduced patient satisfaction. It is essential that all involved in healthcare understand how quality can help. This includes physicians, pharmacists, and administrators. However, all healthcare providers must work in conjunction towards a common quality goal. This presentation will next describe 2 real situations that actually occurred and show how improvement in quality and a reduction of errors could have helped.
So you may be wondering how quality relates to you. For pharmacy, quality is a huge issue. The statistics regarding medication errors are appalling. In the United States, medication errors account for at least 7,000 deaths a year, 1.3 million injuries each year, and occur in about 5% of hospital patients. There are many ways to reduce the occurrence of medication errors. The majority of errors involve the 5 rights, which means that you ensure that you have the right drug, patient, dose, route, and time. These seem like easy concepts, but in the following case you will see an example of how easily they can be overlooked. One widely covered medication error involved this actor, Dennis Quaid. He and his wife had twins on November 8, 2007. Shortly after their birth, they were given heparin, an anticoagulant, but instead of being given heparin 10 units per ml, they were given heparin 10,000 units per ml, which was 1,000 times higher than normal for an infant. As you can see, these 2 bottles of heparin look very similar, and this medication error was not the first of its kind. Heparin is a high alert medication, which means that if given incorrectly, it has a high risk of seriously harming or even killing a patient. 8 of the 31 high alert medications cause 31% of medication errors, and one of these 8 medications is heparin. Dennis Quaid decided to sue the manufacturer of heparin, Baxter Healthcare Corporation, so that this error could be prevented in the future. In the year prior to the errors involving Dennis Quaid's children, 3 other infants had died in Indianapolis, and all Baxter had done was to issue a warning to healthcare providers about the similarity of the labels. We do believe that the labeling of heparin does need to be changed, but the labeling was not the sole cause of error. The pharmacy technician and/or the nurse also made an error. They chose the wrong drug, which, as discussed earlier, is one of the 5 main causes of medication errors. Medical staff need to be aware of the high alert medications to ensure that they are especially careful when administering them. Thankfully, the twins were stabilized within 41 hours and were able to leave the hospital within 14 days. However, other newborns have not been as lucky. Therefore, we all need to be more careful in our decisions and make sure that we are performing our jobs as well as possible. In other words, providing quality care. This case illustrates how one small mistake can have huge consequences. It also points out that there are many areas in which a mistake can occur. Most mistakes aren't the fault of a single person or the result of a single instance. In order to have the best quality possible, healthcare providers need to step back and assess the entire system in order to identify pathways and areas where mistakes could be made.
Why is quality important in medicine, and how does low-quality medicine manifest itself? The problem of medical errors is one that is widely talked about, but it is very difficult to pin down the precise number of medical errors that do occur, and it is even harder to determine the specific cause of each error. What is known is that medical errors have serious impact and can lead to death. When asked about medical errors, the tendency is to talk about leaving a sponge inside of a patient or cutting off the wrong leg. While these types of errors do occur, a much more insidious type of medical error results from failures in communication. Communication is complicated by the many healthcare staff involved in treating a single patient and the blurred lines of responsibility in the modern healthcare team. In the summer of 2010, a 13-month-old boy died as a result of this type of error. He was admitted to the ER for mild second-degree burns as well as some nicks and bruises sustained in a motor vehicle accident. His mother was admitted at the same time for injuries that she suffered. He was immediately coded as a trauma and brought to a room in the ER that quickly filled with around 12 different healthcare staff. medical team quickly realized that, despite the severity of the boy's burns, he suffered no major internal injuries. In fact, all he needed was his wounds to be cleaned and dressed, some IV fluids, and monitoring until his family could come and get him. Perhaps it was due to the stressful nature of working in the ER, or maybe the time of day, or maybe just a simple lack of communication, but none of those things actually happened. Each one of the doctors, residents, and students simply left the room, probably busy with other patients and paperwork, and assuming that someone else would tend to the needs of the child. No IV was started, no wounds were cleaned or dressed, and no family members were contacted. A few hours later, the child died of dehydration. Could have been easily avoided if someone had simply asked who was going to be in charge of executing the treatment plan for the child, instead of assuming it wouldn't be them. This type of medical error is more common than many people would like to admit, and probably the most preventable type of medical error. When something as important as health or life hangs in the balance, the need for good communication skills can simply not be overstated. It's the importance of good communication skills. Workplace communication skills are often regarded as being intuitive or easy. However, this is often not the case. There are many obstacles that prevent communication, especially in hospitals, and these are usually due to a system or a process and not necessarily one person. Hospitals need to implement some sort of process after diagnosis to deal with the implementation of treatment.
In conclusion, healthcare organizations are full of inefficiency and problems. Focusing on quality not only addresses each individual problem, it can fix the overall system. Quality is something that needs to be addressed at every level in order for it to be completely successful. Improving quality in healthcare organization improves patient care and reduces costs.